welcome back to my channel. Today we're going to be doing a study with me with Nikki, who's a nursing student. Woo! And for those who are new to my channel, my name is Rami. I'm an RN BSN. Today we're going to be going over ATI style questions. So today we're going to be using an app. It's a secret app now because apparently it was deleted. ATI deleted it because it has similarities that nursing students are currently taking. Does that make sense?
Yeah, so the app is called RN Mentor, and basically if you didn't have the app before it got deleted, you can't download it anymore. And so what we're using this app for today is to basically test us on our knowledge for like nursing students like me. I'm a senior right now and it's dead week, so now we're preparing for our ATI proctored and our finals. So hopefully we can give you guys some tips and tricks on how to break down the questions and look for what ATI thinks is important.
So we were going over a few of these questions, and the main thing that we noticed was that me as a nurse, I kind of skip over things that I already assumed to be done, and she as a nursing student is already looking for those things. So for example, like we had a question where like someone was carried into the ER, like what is the priority that the nurse has to do like when they first come in? And like the questions were like take vital signs, like do labs, and then there was a different one I forgot because I was already crossed out, and the last one was to immobilize the patient. So I mean, it was like, oh yeah, like I would take vitals. Like I would think that when the patient first comes in and I'm coming in as the nurse, like the patient's already going to be immobilized. So that was the thing that kind of got me. She got the question right. It was immobilized, but we're going to kind of see like how we differentiate things, like me being a nurse and her being a nursing student. Already used to these questions. I graduated almost 3 years ago, so we did not have ATI, and then we kind of just like did like a whole UWorld like question set like towards the end of graduation. That's all the practice I had for the NCLEX. Whereas nursing students now, and I'm hearing nursing students that come to my unit, they're all about ATI. Everything's ATI focused. The questions are ATI focused for every single class, no matter what like the teacher presents, and everything's very similar. Like I feel like in nursing schools these days.
So hopefully this will help us differentiate as nursing students and actually working RNs to know what specifically ATI looks for in the answer rather than what you would do.
We're just going to study together, kind of go through the questions one by one, and then we'll kind of let you guys see these questions since the app is deleted. They give really, really good rationales. So we just hope that in general this helps you. We're not experts or anything. We're not education experts, but hopefully like we can try to break it down. So let's get right into it. So since I'm an OB nurse, we're going to go ahead and do OB maternal nursing questions. We'll go through them, and if you guys like this and you guys want to see more, we can do med surg, pediatrics. Like this app has everything. So we're going to go ahead and start with OB.
So feel free to pause it if you guys need to, but we're going to go straight into the first question, which is a nurse notes that the uterine fundus of a client who is postpartum is 2 finger breadths above the umbilicus, deviated to the right of the midline, and firm. This finding indicates which of the following: A, uterine bleeding, B, bowel obstruction, C, bladder distension, or D, urinary tract infection.
Okay, so let's get down to the topic of the question. What are they asking us? They're asking that a finding, which is the uterine fundus being 2 finger breadths above the umbilicus, deviated to the right of the midline, and firm. So they're asking us, what is that indicating? That's basically the topic. We're gonna try to answer this like you guys, like we've never seen this before, like I've never seen this before. So we're gonna determine, I already know the answer. Do you?
Well, so I know that
yeah, tell me what you know about it.
In the state of the patient right now, they're in postpartum, and so I believe the first 24 hours postpartum, the fundus should be at the midline, firm, and at the umbilicus. So I'm thinking it's bladder distension. What was your guess?
Okay, so I was thinking bladder distension as well, and you are 100% correct. So the fundus is the top of the uterus. So you think of a uterus as a circular muscle or organ, I guess, and the fundus is the very top of it. So you can imagine as the baby gets bigger, the fundus obviously gets bigger and it goes straight to the top. So at full term, the fundus is literally right underneath your sternum. It's right up here. So right after delivery, the baby obviously comes out, the fluid comes out, everything's coming out. So just know this, the fundus or the top of the uterus is going to be in line with the umbilicus after delivery. It's always going to be, if the person's bigger, there's lots of reasons why it may be a little bit higher. It might be a little bit harder to like feel for the fundus. Many reasons, but in general, it's just something that you guys should know. It's going to be at the umbilicus, okay? So 2 finger breadths above, we kind of go by finger breadths by day. The fundus will decrease by 1 finger breadth per day. So after 24 hours, it'll go down 1 from the umbilicus, down 1, down 1. So they're saying it's 2 above, which means it's not in the correct position. It's deviated to the right. The uterus should also always be midline. So if it's to the right, something's going on. Firm is a good indication. So if the uterus is not firm, it's boggy, which just means it's soft, it's not contracting down. Usually that means there's some kind of placenta retained, there's something going on, and it's going to cause a lot of bleeding. So since it's firm, we're not really thinking bleeding. Bleeding may be something you first think of because, you know, they just delivered, it's the uterus, bleeding's a big complication postpartum. But the uterus is firm. So since we know that and it's deviated to the right, what else are we thinking is around there? Probably the bladder.
Right. So whenever the the fundus might be out of line or deviated, which is the word they always use, our first thought as nursing students, what they tell us to is always advise your patient to empty their bladder and see that as the intervention and how it'll affect the patient.
As a nurse, we go through lots of mock codes, is what we call them, or simulations where we have like a mannequin and we like have situations like this. So if there is a uterus that's out of place, one of the first things we'll do on top of like taking vitals and all those things is to insert a Foley, because inserting a Foley will decrease any kind of deviation that's going on because you're taking all the urine out of the bladder. So we're not going to pick A because yes, the uterus is firm. A bowel obstruction, that's pretty unlikely to cause the uterus being deviated unless they had some kind of like huge constipation impaction going on. We're thinking C, and a UTI, that's not really indicative of what's going on here. So you think it's C. She said C in the beginning. C is correct, and the rationale is, we'll put it up there.
So I'm not going to go over the rationale, so I'm going to leave it here for you guys to pause and take notes and read over if you guys want to. And we're going to go straight to the next question.
Okay, so the next question is, a nurse is caring for a client in labor receiving IV Pitocin and having contractions at 90-second intervals that are reaching 80 millimeters of mercury on the internal monitor. Which of the following is an appropriate nursing action? A, stop the Pitocin infusion and position the client on the left side. B, encourage the client to use pattern-paced breathing techniques. C, assess the cervix for dilation and effacement. Or D, notify the provider and prepare for a C-section. So, just from the books and as a student, I know that the interval of the contraction seems, longer or too high?
It seems a little far apart. They're having contractions at 90-second intervals, as in the contraction isn't 90 seconds long, they're having it every 90 seconds, but it doesn't tell us how long.
Oh, okay.
So what do you think?
So all we know, well, all I know right now from this question is that the client's on Pitocin, they're having contractions every 90 seconds, and it's reaching, I guess, to a level of 80 on the monitor.
Okay, so what is the topic? They're asking us what is an appropriate nursing action given what's happening right now. This client is in labor, they're getting Pitocin, that's a very common thing that they use to induce contractions. They're having contractions at 90-second intervals. So they're saying they're having a contraction every 90 seconds, but they're not telling us how long the contraction is. It could be 30 seconds, it could be 120 seconds, it could be going on for a long time, but we do not know. We're going to go with what the question gives us. And they're reaching 80 millimeters of mercury on the internal monitor. So what we use to measure contractions is like a fetal monitoring device that you guys may or may not have seen if you guys haven't had OB clinicals yet. We as nurses don't use that number to measure contractions whatsoever. We have to palpate always. So what we actually do to determine the strength of the contraction, which is what the 80 millimeters of mercury is telling us, is we palpate how strong the contraction is. So as nurses, what we do to palpate the uterus and determine how strong it is we use the words in our charting: mild, moderate, or strong. So usually mild would be the tip of our nose. So if you're palpating your fundus, you touch the tip of your nose, and that's how mild the contractions are. Moderate would be your chin. You can see it's a little bit harder than your nose. So that's moderate by palpation. And strong would be your forehead. So if you palpate your forehead, that's a strong contraction right there. The 80 millimeters of mercury isn't really telling me much, but that she's contracting and the monitor is making the hump. So we're gonna look at the action. Stop the pit infusion and position the clamp on the left side. I feel like that's something that the books will always say, like position the clamp on the left side. That's always really good for maternal OB questions, because it gets the patient off, or it gets the baby's heart rate up usually by turning him on the left side. But I don't see an indication to turn off the pit infusion because she's having it at every 90 seconds. Yeah. So that's pretty good, actually. Those are pretty good contractions. I'm not really sure. We determine too many contractions differently. Like we look at a 30-minute strip, where I was looking at the monitor and seeing 90-second intervals, which is a minute and a half. She may be contracting too much, and they may want us to position on the left side, but we don't have an indication of if the fetal heart rate's going down or not. So we're gonna keep on going. Encourage a client to use pattern-paced breathing techniques. What do you know about pattern-paced breathing techniques?
So that's probably just a intervention that's therapeutic for the patient, just to calm them down so their respirations aren't too high. And it's probably the most simplest intervention you can take. Mm-hmm. But you wouldn't do that in a serious complication. It'd just be for if their respirations were too high.
Yeah, so I think pattern pace is just to kind of like calm them down and to kind of help with the contractions. So we'll keep on going. Assess the cervix for dilation and effacement. I don't see an indication for that either, unless the patient was feeling like vaginal pressure or the baby was having early. So we're going to keep on going. Notify the provider and prepare for a C-section. I think that's definitely one of those throw-out questions that they kind of just threw in there to throw you off, but if they're having contractions, good for them. They're in labor. They're supposed to have contractions, and they're reaching a certain amount. Let's just throw that out because that doesn't need to be there. We're not preparing for a C-section. We don't know anything about the fetal heart rate. So my best guess is B, to encourage the client to use pattern-paced breathing techniques, because it's to kind of help them with the contractions and kind of soothe them along. They're asking for the most appropriate nursing action. So that's my best guess, given what we got. What do you think?
I actually went with A, to stop the pit and position the client on the left, just from former exams always indicating that intervention, that if their contractions are too close together, they always want us to reposition the patient and stop the Pitocin. But what I'm not remembering right now is the specific interval number that it should be at, where it's too dangerous for the patient or that it's healthy for the active patient in labor. So what do you want to go with? Just
I'm going with B, but I think it may be A, only because
it's 90 seconds.
They're trying to, yeah.
If I remember correct, every 2 to 3 minutes is what they want, but we can check the rationale right now.
Ooh, you're right. Yeah, I see what you mean. Okay.
So I'm guessing from the RN perspective, they see frequent contractions, and they're like, wow, this is a great sign. They're in active labor, they're progressing. But in the student side, they always tell us, okay, this is a specific measurement or interval that you have to follow, and if it's not that number, then it's dangerous for the patient. And so what they're labeling this contraction at 90-second intervals is intense contractions and uterine hyperstimulation.
Yeah,
so that's just a student thing that we have to be aware of.
When in doubt, just try to get in the minds of the ATI writers and just know that they're trying to make new grads or all nursing students not kill the patient. They're all about safety, safety, safety. So us as nurses, we're just like, whatever, she's contracting, and she's, like she said, woohoo. And that's what we think. So I'm just like, okay, breathing, that's what, I'll be my next intervention, not to stop the Pitocin, because I don't really have, a good scale of where the fetus is at. I don't see that they're having lates or anything. They didn't say anything like that, but try to get in the minds of the ATI writers. And they're all about safety, so we're going to keep that in mind for our next question.
A nurse is caring for a client who is in labor and is dilated to 8 centimeters and fully effaced. Which of the following might be an effect of Demerol when administered this late in labor, for which the nurse should monitor? A. Cessation of contractions. B. Neonatal hepatic toxicity. C. Ineffective reduction of pain. Or D. Neonatal respiratory depression.
Okay, this one is a little harder. So basically we are asking why... Okay, so this patient is 8 centimeters, fully effaced. So effacement is the thinness. Sorry, we're out of focus. Effacement is the thinness of how the cervix is. So usually you start out with it pretty thick, and that's when you're 0% effaced, I guess. And the thinner you get until you can't feel the cervix anymore when you do a vaginal check, you're 100% effaced. And that's all, you're just feeling the baby's head at that point. There's no cervix. The cervix has thinned out completely. So this patient is 8 centimeters and fully effaced. She's fully thinned out. We're just feeling the head at this point. So what is an effect of Demerol when administered this late in labor, for which the nurse should monitor? Do you know what Demerol is?
I'm not sure what this medication does, to be honest. So right now, as a student, I would just do process of elimination. What might be the best answer for me? So A, cessation of contraction. This would just mean that her contractions stopped, which is a bad sign, obviously. Neonatal hepatic toxicity, which means the infant's liver would be affected. Or C, ineffective reduction of pain, which means that somehow the Demerol interfered with pain medication that was given before. Or D, neonatal respiratory depression, which sort of sounds the best for me, because I know that medication given when a patient is in active labor, especially late in active labor, can affect respiratory depression. So that's what I would go with, but you probably have a better answer.
So Demerol is a pain medication, okay? So this one's a little tough for me because I'm an antepartum nurse. I usually just induce patients till they're about a 5, and then we send them over to labor and delivery where they have their baby. So we don't give Demerol that much, but I do know it's a pain medication. So it could stop contractions only because of pain medication. Yeah, it relaxes the uterine muscle. So they're asking us when it's administered this late in labor. That's kind of a keyword for me. B, neonatal hepatic toxicity. I don't think we would give Demerol if that's what happened to the baby's liver. But I'm gonna keep going. Ineffective reduction of pain. I'm kind of leaning towards that because I think I'm focusing too much on the keywords this late in labor. Like they're saying she's fully effaced. She's literally about to just dilate a little bit more and push out that baby. So maybe Demerol may not be effective at that point in labor. Neonatal respiratory depression. So if you guys see B and D, neonatal means after the baby's born. Fetal means while they're still in the uterus. So neonatal respiratory depression, they're saying if we give this, then the neonate may have problems breathing after birth. And they may have some toxicity in their liver after birth after giving Demerol. It could be D because she's literally about to deliver, but you think it's D?
C and D sound pretty good.
They both sound pretty good. Might be effect of Demerol when administered this late in labor for which the nurse should monitor. I think it actually may be D.
Okay, so we're gonna try for D.
Ah! Woo! You got it right. With all narcotics, Demerol is a pretty heavy narcotic. It's similar to like morphine, Stadol, those kind of medications. So respiratory depression, if you guys are in nursing school and know about narcotics, that's a huge side effect of those heavy narcotics like morphine and Demerol. So they're saying just because it's given late in labor, it crosses the placental barrier to the baby quickly when they're about to be born, and it still could have an effect as the baby is while the baby's born, because the mom's blood flow hasn't filtered it out yet, or it hasn't come out of the baby back to the maternal like circulation yet. That makes sense. So they're saying that because they gave it late in labor, the baby's about to be delivered, it could still have an effect on the baby, and respiratory depression side effect is now given to the baby. So we got it. I was trying to think more towards like the safety ATI mindset, because ineffective reduction of pain, like I feel like they don't have answers like that.
Address the patient's pain.
Yeah, like the most significant effect first, even if it may not happen. Like I would think giving it that late, it may not have an effect on the patient because, you know, they're about to deliver this baby, but they're thinking more for the safety of the baby, not the patient. So,
right.
Cool. Next question.
A nurse is working with a client who is a gravida 1 para 0 with frequent episodes of indigestion. Which of the following should the nurse suggest to help ease the symptoms? A. Eat a large evening meal. B. Decrease intake of spicy foods. C. Rest in a supine position for a few minutes after eating. Or D. Increase intake of water and carbonated beverages.
So, what is the topic?
Okay, so right now we're talking about basically a client that's having episodes of indigestion.
Mm-hmm.
So they're wondering, is this normal? Is this a complication? Should they do something different?
So they're asking, all of these are interventions to basically see how we can stop indigestion. So gravida 1, para 0, if you guys remember GP TPAL, gravida is the number of pregnancies, para is the number of births. So if you have twins, your gravida would be 1 and your para would be 2. So that always throws people off. If you have triplets, this para is 3, gravida is 1. Gravida is the number of pregnancies, so paras are the number of births. So clearly she's pregnant, she hasn't delivered yet, she's a G1, gravida 1, para 0.
And I think on the ATI booklets and stuff, they specifically define para as a fetus making it past 20 weeks.
Okay, that's a good one.
So I guess just keep that in mind whenever they ask you these sort of questions, because I love to ask you, what's it called?
P-TAL?
P-TAL?
Yeah, so
P-TAL
preterm and term and preterm and abortions and living. So we can go over that in a different video if you guys want us to get more in depth in it, but for now they're just asking us the gravida and paras, which I feel like is a lot more common in like the NCLEX questions. Like they won't go into the whole TPAL specifics unless like the question is focused on literally GP TPAL. So the nurse is suggesting which of the following to ease the symptoms. Eat a large evening meal. So eating large evening meals is not going to help with indigestion whatsoever. We always think of small, frequent meals to help your stomach digest food and absorb the food without bloating up your stomach and causing indigestion. So we're going to cross out A. Decrease intake of spicy foods. That's a really big one, especially for pregnant patients. I feel like we as nurses, whenever we send them home antepartum, we always tell them if your stomach's feeling upset, eat small frequent meals, bland if possible, if you can't handle like spicy foods. We do say decrease the intake of spicy foods. So that's a good one to keep in mind. Resting in a supine position for a few minutes after eating. Supine means flat. And if you guys think about it, eating and laying flat is probably going to make the indigestion worse. So that one's probably going to be out. And increase the intake of water and carbonated beverages. Water is a really good one. Carbonated beverages, not so much, because carbonated means bubbly, sodas, things that have bubbles in it, basically. And I think bubbles cause a lot of indigestion, heartburn, things like that.
Yeah. Well, as a student, I kind of break this question down by remembering or eliminating what does cause indigestion. And I know that large meals, especially at night, actually induce indigestion. And I know that lying flat or supine actually induces indigestion, and that water helps with digestion, but carbonated beverages also cause episodes of indigestion. So they kind of just threw in D just to see if, you know, you'd choose that because of the water. But I would definitely go with B, with decreasing the intake of spicy foods, just like Rami said. And we can check out the answer right now.
And we got it right!
A nurse is caring for a client who's 48 hours postpartum and reports the episiotomy incision is pulling and stinging. What action should the nurse implement? A. Encourage the client to ambulate. B. Provide a sitz bath with warm water. C. Place an ice pack to the client's perineal area. Or D. Administer prescribed narcotic medication.
Ooh, I apologize in advance, guys, for the lighting. Our natural lighting went away, so we just have this artificial light in the room, but we're gonna keep on going. An episiotomy is when the baby's head isn't coming out completely and they need a little bit of assistance. The doctor will make a cut in the vagina, depending on where the baby's head is turned, to open up the vagina, basically. And of course they suture it up after delivery, after the baby came out. So basically it's pulling and stinging, which is a very normal finding. How are we going to help this client out?
From the student perspective, again, I know that normal findings with an episiotomy are pulling and stinging. They're gonna have pain. I mean, part of them was just cut open. And A says to encourage the client to ambulate. So this intervention to me isn't the best one because it sort of doesn't address their pain. It kind of just tells them to get up and walk and it'll be okay. B says provide a sitz bath with warm water. To me that sounds like a good answer because within the episiotomy, a lot of time in ATI, I know they always refer to use a sitz bath. So, and it's sort of the first therapeutic intervention you can do. And then place an ice pack on the client's perineal area, which could also be effective, but I feel like not as much as the sitz bath. And administer prescribed narcotic medication, which also sounds right to me, but I feel like the first line of intervention to me would be the sitz bath.
Yeah. So that's another big thing with ATI. A lot of the questions seem good. All of these questions seem pretty good. And our whole deal is to pick the most right one. So that's the hardest thing about NCLEX. And that's what we're trying to kind of help out by kind of rationalizing through the answers. So I am going with yours as well. These are all good answers. Ambulation is really important in postpartum, but it's not really going to help with her pain. We're trying to direct her pain right now. Narcotics, probably 48 hours after. We're trying to kind of avoid narcotics and kind of just give them like Tylenols and ibuprofens, things like that, to kind of weed them off the heavy narcotics. The ice pack is also a good idea, but I think it doesn't really get into the episiotomy and kind of provide the relief as well as a sitz bath would. So yay! Sitz bath is the answer. Honestly, we don't do a lot of sitz baths postpartum. We do a lot of ice packs more, but I kind of see the ATI, like, I don't know. We just don't do sitz baths that often postpartum, but so you guys can see the rationale. We'll put it up on the screen. So we hope that you guys enjoyed this, studied with us. Hopefully it kind of helped you guys out if you're a new grad or if you are still in nursing school and trying to figure out ATI. Hopefully this helps you with your questions. If you guys want to see more, if you guys want to see a different topic, we can cover med-surg, pediatrics, and we can study together for that. So give us a thumbs up. Go ahead and click that subscribe button. I don't know what corner it's in if you guys want to see more. And comment what else you guys want to see.
So hopefully it helped other nursing students like me to kind of break down ATI questions and determine, you know, what's the priority action or kind of what they look for. But just let us know if you want to see more content like this. And I know we didn't get every single answer correct. So that's just part of the process, and especially great about like quizzes like this because it helps you learn what you need to focus on and what they're really looking for.
Yeah, and overall, you guys will not know everything there is to know about nursing. There's so much. I know how overwhelmed I was as a nursing student. So I hope this video kind of helps you just break down the questions because ATI does have a specific writing style, and they try to just help you prepare for the NCLEX overall. You're never going to know everything. There's just way too much to know. So hopefully this video just helps you figure it out and be able to take each question one step at a time. Well, make sure you subscribe to see more content and like this video and leave us a comment to let us know what else you guys want to see.
Bye!